Hello, my name is Mark Rothstein, and I've been asked to answer some questions about COVID that are on your minds, and I will hope to do so much like I did in the last 2 years, as I've had 3 prior videos that I've recorded. Some of you might have seen one or more of these. In each one, I tried to answer questions about vaccines, testing, treatment, prevention, and new variants. And today I'm going to focus largely on the new variant issue. As with my prior videos, I want to start with a disclaimer. I'm not a physician, and nothing I say should be considered medical advice. I'm also not an epidemiologist, a virologist, or other type of scientist. My background is in public health ethics, law, and policy. I have previously served as an advisor to the CDC on coronavirus policy, and I've written widely on public health response to COVID. So I've spent a lot of time working on this issue. This video is being recorded on July 20th, 2022. Some of you may recall that in the prior videos, I ended them by attempting to answer the question about when I thought the pandemic might be over. In all of them, I think I said it was difficult to predict, but we could hasten the end of the pandemic by adopting sound public health practices, such as vaccination and social distancing. Now, with over 1 million deaths in the US and over 6 million deaths worldwide, many experts are saying that COVID will not be over anytime soon, and it in fact may never be over. These experts assert that because COVID has become endemic in the world population, the best case scenario for the future would be that COVID would periodically disappear and then later reappear, something like seasonal influenza. We all hope that if that's the case, that better vaccines and treatments will limit COVID severity, especially the hospitalizations and deaths. Now, this may not be the cheeriest future to contemplate, but there are consequences when, as a society, public health measures are ignored or valued less than commercial, personal, or political interests. Today in the US, only about 2/3 of the population has been vaccinated, and only about half of those 2/3 have received a booster. In the US, we have more safe, effective, free vaccines than people willing to take them. Worldwide, there are low-income countries where few people have been vaccinated because they simply can't afford it. The longer a rapidly mutating virus is permitted to replicate in a large population, the greater the likelihood that new variants and subvariants will emerge. And these new forms of the virus may be more infectious or lethal. So with that dark cloud of a lead-in, I will try to answer the 10 questions I received. So the first one is it true that COVID will just get milder now? I'm afraid this is not true. For people with no underlying health conditions who are vaccinated and boosted, if their breakthrough infection is diagnosed early and treated promptly, the prognosis is very good. But even a mild case of COVID is no picnic. And if the population frequency of infected people remains high, older people and those with underlying health conditions remain at substantial risk and often are forced to live a reclusive lifestyle. And even people with mild cases of COVID can get long COVID, a condition where symptoms last for many months. And we still don't know what causes it, and we don't know what the future holds for them. So the second question, will there be another lockdown? I doubt it, but you never know. Today, I think it's clear that there is very little public support in the US for more stringent social distancing measures. Third question, is it possible for people who have been sick with COVID-like symptoms to repeatedly test negative on a PCR test? And the answer to that is yes. It's not entirely clear why this is the case, One theory is that the testing may be too early in the course of disease when the individual isn't shedding sufficient amounts of virus. But one would think that the amplification process of PCR testing would account for this. Another theory is that the testing may be taking place too late, and that the people who are tested are actually in the phase when they're getting over it, and therefore they don't test positive. One estimate is that up to 1/5 of negative PCR tests for COVID are false negatives. That's why an individual's exposures and symptoms may be more important than test results. Question 4. I've heard that vaccines have little to no effect on Omicron BA.5, which I'm going to be talking about in the rest of my video today. And if you test positive for that subvariant, you can get it again. Is that true? So these are both very important questions, and I want to answer them in separate parts. First, it's important to understand what vaccination is designed to do. Although COVID vaccination helps to prevent infections, their main purpose is to prevent severe infections that would lead to hospitalization, admission to an ICU, or even death. In this way, vaccination helps the individual, obviously, but it also helps take pressure off strained healthcare institutions, and that lets them care for other people with other sorts of serious illnesses like cancer and heart attacks. The new Omicron subvariants, called BA.4 and BA.5, now account for over 80% of the new cases. The current vaccines are effective against these subvariants in helping to keep infections less severe. But because these subvariants are more contagious, the risk of becoming infected is greater than before. New variant-specific vaccines are being developed, and they may be more effective, but it's not clear by how much more effective they will be. So the second part of the question asked whether an infected person can become infected again. The answer is yes, and it is more likely with the BA.5 subvariant. With the previous variants, people who were infected with COVID developed antibodies that would protect them for several months, and then the immunity would start to wane over time. With BA.5, there are cases of people becoming reinfected weeks rather than months later. However, one good thing to note is that people who are reinfected tend to have milder cases because they have some level of protective antibodies. People who have had COVID, regardless of the variant, should be vaccinated. Question 5 asks, if I wear a mask and gloves, is it safe for me to travel on a plane? So to begin with, I see no reason to wear gloves. COVID is a respiratory infection, and gloves offer no protection. I've never worn gloves during the pandemic. Whether it's safe to travel on an airplane depends on your underlying health conditions, on your vaccination status, including whether you have your boosters, on the protective measures that you're taking on the plane, and your risk tolerance. In my experience, after the mask mandate was eliminated from air travel, less than 10% of passengers wear masks, and some who do wear them below their nose or even below their chin, so they're worthless. One must assume that at least a few passengers on a large airplane are infected, and therefore it is risky to be in a confined space with them for hours, especially now that the highly contagious BA.5 subvariant is the dominant strain in the United States. The ventilation on airplanes is actually excellent, and that certainly helps to reduce the risk by constantly filtering and recirculating the air. If you keep your vent open and your mask on, you greatly reduce the risk of becoming infected. Unless the situation gets worse, I would be comfortable in limited airplane travel. You also need to be vigilant in waiting areas and on shuttle buses, in eating and drinking around other passengers before the flight, and in other aspects of air travel. But if you're careful. I don't see any reason why you shouldn't go on airplanes. Number 6, would it help to wear more than one mask to get protection against the latest variants? I think it's more important to wear a high quality mask than layers of masks. That means an N95 or KN95 and wearing it in a way that has a good face seal so that air can't get around the mask. I don't see much value in cloth masks, and even surgical masks are probably inadequate to provide significant protection against the new subvariants. Question number 7, what is the risk of getting infected from surfaces and furniture? I think it's close to 0. Fomites are objects or materials like clothing and furniture on which certain kinds of infectious agents can live for hours or days. It's important that various surfaces are cleaned and disinfected to prevent the spread of many types of germs, but COVID is spread by airborne exposure and not fomites. There is no point in obsessively wiping down surfaces and attempting to prevent COVID. Unless you are immunocompromised or trying to prevent a cold, I see little value in wiping down everything with Purell. Number 8, should I get a booster now or wait until the fall when variant-specific boosters become available? My advice would be don't wait. If you are eligible for a booster, please get it now. You can get another Omicron booster in the fall when they are available. Question 9, are COVID vaccines safe for children, including for the long term? I think the first question you need to ask yourself to get a good handle on this question is, does COVID present a risk to children? Children are less susceptible to severe cases of COVID than adults, but they are still at risk. As of today, July 20th, 2022, over 1,300 children ages 0 to 18 have died of COVID, including 463 children ages 0 to 4. And 760 children are hospitalized every day for COVID. So there is definitely a risk. And with the new subvariants, I think the risk is increasing. Are the vaccines effective? Yes. They were in clinical research in thousands of children before they received FDA approval and CDC's recommendation. And they were shown to be safe and effective. Now, perhaps the hardest question to get a handle on is, but how can we be sure that there will not be an adverse event years from now? Obviously, we can't be sure because it's the future, and these vaccines have been around only for a little over a year. But we can look at numerous vaccines that have been given to hundreds of millions of children for decades, such as for measles, mumps, rubella, smallpox, whooping cough, etc. And there have not been the delayed risks that some have feared. Finally, on a personal level, I did a fair amount of research on this question before I strongly recommended that my 2 granddaughters, ages 8 and 5, get vaccinated, and I am happy to report that they both have been. So number 10 is not a COVID question, but it's one that came in today, and I'm pleased to answer it. Can you say a few words about monkeypox? And monkeypox, as you know, has spread from its Africa basis around the world, including to the United States. It actually gets its name not because it's spread by monkeys, but because it was first discovered in monkeys. The source of the disease remains unknown, although we do know that it originated in Central and West Africa. It is a type of variola virus that's related to smallpox, but not chickenpox. Symptoms include fever, headache, muscle aches, swollen lymph nodes, etc. But these are symptoms for many illnesses. The one characteristic symptom for monkeypox is the pox part, and that is a rash that can look like pimples or blisters and appear on virtually any part of the body. It is spread from person to person through direct contact with the rash, with the scabs on the rash, or body fluids. It also can be spread through respiratory secretions, close contact, including sexual contact, and fomites, which I talked about earlier. Here it is important to disinfect surfaces, clothing, etc., because monkeypox can be spread that way. The illness lasts 2 to 4 weeks, and it's very painful. The fatality rate is 1 to 10%, depending on the strain of monkeypox that you get. In the US, at the current time, most of the people infected with monkeypox are men who have sex with men. Treatment is with antiviral drugs, although there is no specific drug for monkeypox. Vaccines are available for people who have had or who are likely to have exposure, including healthcare workers. More information on monkeypox is available on the website of the CDC and other public health agencies. That concludes today's video. Thank you to those of you who submitted questions. I hope my answers were helpful. Nothing would make me happier than to have this be my last COVID update, but if necessary, I am available to answer more of your questions. Please stay safe, but don't let the fear of COVID rule your life.